Welcome to Baylor Scott & White Health Plan's Annual Notice of Change for Central Texas. We are excited to share the changes that will be made to your Medicare Advantage plans effective January 1, 2026. Today we will discuss what is changing for 2026. We will also share a few of our SeniorCare Advantage highlights and discuss two upcoming Medicare Advantage election periods. Then we will review the changes to each of our Baylor Scott & White SeniorCare Advantage plans, their medical benefits, prescription drug coverage, and extra benefits. Lastly, we will share the contact information for the departments and benefits discussed and be able to answer any questions. Here are our Medicare plan highlights. Bonus benefits included in the plans are such as routine, dental, vision, and hearing visits, a quarterly over-the-counter allowance, no referrals are required to see a specialist, there are no costs for telehealth visits with primary care physicians, specialists, or psychiatrists. The plans also offer $0 copays for many mail-order prescriptions. We have preferred pharmacies that offer lower prescription copays. Worldwide emergency room and urgent care coverage is included. There are two upcoming Medicare Advantage election periods that allow Medicare Advantage members to make a plan change. The first, the annual election period AEP, allows Medicare Advantage eligible individuals to enroll or disenroll from a Medicare Advantage plan from October 15th through December 7th each year. A plan selection made during this time would become effective January 1st of 2026. The second is the Medicare Advantage Open Enrollment Period, OEP, and this takes place annually from January 1st through March 31st and allows individuals enrolled in a Medicare Advantage plan to make a one-time election to go onto another Medicare Advantage plan or back to original Medicare. Individuals using the OEP to make a change may make a change to add or drop Part D coverage. So, what is changing for 2026? CMS is ending the Value-Based Insurance Design Program, otherwise known as VBID, on December 31st, 2025. Baylor Scott & White SeniorCare Advantage Select RX Assist will change its name to Baylor Scott & White SeniorCare Advantage Essentials. White Health Plan, we want you to live your best life. As a Baylor Scott & White Health Plan member, you have access to the Baylor Scott & White Quality Alliance and their suite of unique resources, including specialized 65-plus care coordination tools. We want to help you get the right care at the right time, at the right place. 360 visits, a dedicated visit up to 1 hour to enhance the care provided by your primary care provider. These visits provide patients with personalized assessment that lasts up to 1 hour to review your health history, discuss your health needs and goals, and connect you to resources that may be helpful. After the 360 visit, your primary care provider will continue to manage your care needs. A follow-up visit will be scheduled with them. These visits are based on specific eligibility and criteria. One of the groups of patients who are eligible for this visit are patients who are new to the Scott & White Senior Health Plan. Interested patients can talk with their Baylor Scott & White doctor about their 360 visit eligibility. 65-plus clinics, a dedicated care team who provides high-touch care for our medically complex patients. The 65-plus clinics located within CDM Temple, Killeen Family Medicine, Coppers Cove Family Medicine, Georgetown, and DDA Plano coming soon provide care to patients 60 years and older with multiple chronic diseases. Your first visit is up to 1 hour long to review your medical history and introduce you to members of your care team. You may have more visits as needed with your care team, and you will have access to the 65-plus clinic dedicated phone line. One of our 65-plus clinic patients said the amount of time they get to spend with their provider is priceless. This clinic is based on specific eligibility and criteria. Interested patients can talk with their Baylor Scott & White primary care provider about their 65-plus clinic eligibility. CareNav Plus is a one-stop shop resource for your healthcare needs and services. Our care navigators can assist you with clinical needs and guide you to the right level of care, help you with medication refills, answer your billing questions, offer My BSW Health app support, and educate you on your insurance benefits. You can contact CareNav Plus Monday through Friday, 8 a.m. to 5 p.m. Their number is 833-818-1339. You can call CareNav Plus whenever you need help navigating your healthcare. Our kidney health program helps patients better manage their chronic kidney disease and related conditions such as diabetes and high blood pressure. Additionally, if a patient's CKD worsens into end-stage renal disease, Kidney Health Program supports patients during and after this transition by helping them understand treatment options and make hard decisions. Patients can access their care team through phone calls, video, or two-way texting. The texting feature also provides personalized health education, reminders, and check-ins. To get started, patients can talk to their provider about referring them for care management. On this slide, we will examine the important changes to Medicare Part D. The out-of-pocket threshold has changed to $2,100, and during the catastrophic phase, members pay $0. Medicare is continuing the prescription payment plan. This plan is not mandatory. This Medicare plan gives you the option to spread out the cost of your prescriptions over the plan year. Again, this plan is not mandatory. Mail order prescriptions. In August, the mail order prescriptions changed to Costco Pharmacy. Many of you already know about this change and are actively using the program. For those of you who want to utilize the mail order prescription service, contact resources will be shared at the end of this meeting. You still are able to use your retail pharmacy. Visit mybswhealth.com and log into your member portal to enroll and manage your active mail order prescriptions and your preferred retail pharmacy. Our HMO plan covers 34 counties across Central Texas, including the Select and Select RX, Preferred and Preferred RX, Premium and Premium RX, the BSW SeniorCare Advantage Essentials HMO POS. New counties covering in 2026 are Erath counties, Bastrop, Caldwell, Gonzales, and Colorado counties. In 2026, we will continue to offer Select, Preferred, and Premium plan options. Let's discuss the HMO POS medical benefits. HMO POS plans require you to use an in-network provider. As a member of one of our HMO POS plans, you have access to all Baylor Scott & White health providers across Central and North Texas. The monthly premium with RX benefits remain at $0 for the Select plan, change to $143 for the Preferred plan, and $255 for the Premium plan. The monthly premium without RX benefits remain the same, except the change to $89 for the Preferred plan. The HMO POS Select without prescription drug coverage pays $50 toward your Part B premium. This reduction is applied to your Social Security check. Contact Social Security or go to ssa.gov for more information. The annual maximum out-of-pocket does not include prescription drugs. The out-of-pocket maximums will remain the same for 2026. There are no changes to the primary copays and specialty copays. Skilled nursing facility care allowance has changed on days 21 through 100. The Select changes to $218 per day, Preferred changes to $100 per day, and Premium changes to $50 per day. Emergency care has changed to a $130 copay for the Select and Preferred plans. The first and most exciting change is eye exams, eyewear, hearing exams, and hearing aids will be point of service for 2026. This means you may receive the benefit from any provider. The eyewear allowance for the Select plan with RX benefits has changed to $185 for 2026. The other plan allowances will remain the same for 2026. A routine hearing exam is also included at $0 copay on all HMO POS plans. The hearing aid allowance will change on the Select plan with RX benefits to $3,500 for 2026. The other plan allowances will remain the same and will be point of service for 2026. This allowance can be used toward the purchase of hearing aids once every 3 years. Denture coverages remain the same, except Select with RX will have 0% coinsurance for 2026. The over-the-counter allowance will remain the same, except for the Select with RX. It changes to $80 per quarter in 2026. A gym or fitness club membership is included and provided by Silver and Fit. You have access to both the in-home program and a gym membership. You can search for a gym at silverandfit.com or give us a call for more information. We have a preferred and standard pharmacy network. Reduced drug copays are available through our preferred pharmacy network. The Select RX deductible for tiers 3 through 5 changes to $250. The others remain the same. For 2026, the maximum you will pay out of pocket is $2,100. During the catastrophic phase, there are $0 copays. Tier 4 has changed to 35% coinsurance for the HMO POS plans. Tier 5, the Select RX plan, has changed to 30% coinsurance. Tier 4 mail order will be changing to 35% coinsurance. Members must use network pharmacies, no out-of-network benefits. Most adult Part D vaccines are covered at no cost to you. And now for 2026, the introduction of the Baylor Scott & White SeniorCare Advantage Essentials HMO POS plan, only a name change from the Select RX Assist in previous years. Changing for 2026 on the medical benefits for the SeniorCare Advantage Essentials HMO POS plan are The monthly premium remains $0 with extra help and changes to $4.80 without extra help. Skilled nursing facility care allowance, days 21 to 100, change to $218 per day. Emergency care changes to a $130 copay, and chiropractic services change to a $15 copay. The most exciting change to the Baylor Scott & White SeniorCare Advantage Essentials HMO POS is point of service for eye exams, eyewear, hearing exams, and hearing aids for 2026. This means you can receive benefits from any provider. The eyewear allowance for the Baylor Scott & White SeniorCare Advantage Essentials HMO POS has changed to $150 for 2026. A routine hearing exam is also included with a $0 copay. A hearing aid allowance will change on the Baylor Scott & White Essentials HMO POS to $1,000 for 2026. This allowance can be used towards the purchase of hearing aids once every 3 years. The over-the-counter allowance will remain the same, except the grocery benefit will no longer be included for 2026 on the Essentials plan only. Prescription drug benefits on the Baylor Scott & White SeniorCare Advantage Essentials HMO POS are as follows. The deductible for the Advantage Essentials HMO POS without extra help has changed to $615. The Advantage Essentials HMO POS with extra help remains at a $0 deductible. The total out-of-pocket for 2026 is $2,100 with or without extra help. And now on to the PPO plans. Our Central Texas PPO plans cover 29 counties, including the basic and platinum plans. Here is an overview of the PPO medical benefits for 2026. There aren't many changes for the upcoming year. The monthly premium for the basic is still $0. The platinum has changed to $135. Skilled nursing facility care allowance on the basic plan changes to $218 for days 21 to 100. Emergency care copays have changed to $130. And chiropractic services now have a $15 copay. Our supplemental benefits for the SeniorCare Advantage PPO plans have just a few changes as well for the coming year. The hearing aid allowance can be used once every 3 years, including OTC or prescription hearing aids. The dental annual benefit allowance has changed on the basic plan to $3,000. Both plans still have 50% co-insurance for dentures. Annual physical exams have changed to a $0 copay. The over-the-counter benefit, OTC card, has changed to a $30 on the Platinum plan, once every quarter. The prescription drug benefits on the PPO plan remain largely the same. Changes include the total out-of-pocket will be $2,100 for 2026. Tier 4 drugs have changed to 35% co-insurance on both plans. To help you take full advantage of your benefits, or if you just have questions, please take note of these helpful resources. If you need assistance using any of your benefits, please give us a call at customer service using the number at the top left of the screen, 1-866-334-3141. And this brings us to the end of the annual Notice of Change presentation for Central Texas 2026. If there are any questions about these changes, we're more than happy to assist you. If you have specific questions about our plans, please call our customer service department at 866-334-3141.